8 common diseases in the elderly. In this video, I'm going to talk about diseases that increase a lot with age, and many of them are avoidable. You can prevent the onset of these diseases, and if you do, you'll have a much higher quality of life. You just need to know what these diseases are. Let's get started. And since I'm going to talk about 8 diseases, I'm going to set a goal of 8,000 likes. So drop your contribution. It helps a lot for the video to be distributed and also encourages me to continue passing on information to you for free. Starting with number 8, I'm going to do it in descending order. And the first disease I want to call attention to is osteoporosis, weak bones that occur when bone demineralization takes place. The bones get weak. That's a simple way to put it. And how can you prevent this disease, the onset of osteoporosis? The first thing is making an early diagnosis. You find out in an early stage, and how can you do that? Through an exam called bone density. What is the recommendation from the Ministry of Health? For women, start taking the exam at age 65, and for men at 70 years old. What's the catch here? If you have any risk factors, you should start screening earlier. What would these risk factors be? Smoking, for example. Sometimes you've never smoked, but you're a passive smoker. Also, using corticosteroids, drugs that can alter bone mineralization, which can weaken bones. Also, a sedentary lifestyle or diseases like hypothyroidism, changes in the thyroid that can also weaken bone health. So there are several risk factors that will require an investigation beforehand. And if you receive an early diagnosis, you can prevent the progression of this disease, which indeed increases your risk of death. That's just how important this video is. So, bone densitometry, have you had that test? It's very important. Comment here and tell me which city you're watching from and what part of the world you're in. We have lots of viewers from Portugal, the United States, and Japan. Okay, here we go. So, osteoporosis is very common. Thyroid diseases. I've already talked a bit about osteoporosis, but changes in the thyroid are very common in the elderly and can go up to more than 10%. In some specific groups, this rate is even higher. I want to point out that the symptoms of thyroid disease, hormonal changes, are often different in the elderly. So, for example, hyperthyroidism, when the thyroid produces an excess of T3 and T4 hormones, what would be the symptoms? Tremors, restlessness, blood pressure can increase weight loss, but in the elderly often the first symptom will be an arrhythmia, atrial fibrillation, for example. It doesn't always have those classic symptoms. That's why it's important to perform routine exams like the TSH and T4-LIV to investigate this, because those diseases are very common and can also end up affecting other systems. They end up increasing the frequency of high blood pressure, for example, which is also a very common disease, leading to a series of consequences, okay? Therefore, thyroid diseases, the elderly must be very attentive because it increases in this group and the symptoms are not typical. You can't tell only by symptoms. This is the clear message. You have to take an exam to investigate. Dyslipidemias, alterations in cholesterol, and also triglycerides. And alterations in cholesterol, high cholesterol or low good cholesterol, HDL or bad cholesterol high, right, in quotes, which would be LDL, are risk factors for heart disease. Same goes for thyroid disease. You can't know without taking an exam. Knowing this requires an exam. Therefore, cholesterol exams are also essential at this age for you to be able to undergo treatment. Changes in triglycerides levels are extremely common, and the treatment is relatively simple. Often, high triglycerides can be reversed just with diet tips. Number 5, vitamin B12 deficiency. In the elderly, vitamin B12 deficiency can reach up to 20% because as time goes on, the stomach loses its ability to produce a type of acid, which is essential for the absorption of vitamin B12, and it can have several consequences. What is the function of vitamin B? It aids in the production of red blood cells, so you can experience anemia, fatigue, even a weak heart caused by anemia and heart failure, plus neurological changes like forgetfulness. It is a cause of dementia, including a reversible cause of dementia. So a vitamin B12 test is another crucial examination for the elderly to undertake. And then You might think, but I eat meat, so I won't be deficient. This is a thought, a very misguided thought, because we already know that you can have a diet rich in vitamin B12, but often your body doesn't absorb it. Do you remember when I talked about stomach acid production? So you could be deficient because you can't absorb it or because your diet is inadequate. In some situations during pregnancy, for example, which isn't the case here, but it can also happen due to a greater need and deficiency of vitamin B12, it has a relatively simple treatment. If you know one and you're seeing that all these diseases that I'm talking about here, as long as you know, you can avoid a lot of consequences. And number 4, a urinary tract infection. And it doesn't always have those classic symptoms of pain. Sometimes it'll manifest itself only with an increase in urinary frequency. So, if you're awake often to go to the bathroom, you have to investigate. For example, this issue of urinary tract infection is very neglected. People often think about various other causes and forget about a very common condition that also has consequences if not identified, which is a urinary tract infection. Number 3, coming to extremely common diseases in the elderly, and this one affects over half, more than 50% of the elderly, which is anxiety disorder or depression, which are also much neglected at this age. So, be very alert, especially since the incidence has increased. The frequency of these diseases is increasing every year. Number 2, diabetes, also very common. It's not because I'm a specialist that I put it in second place, but changes in blood sugar levels end up increasing a lot in the elderly. And here I want to highlight type 2 diabetes, which often doesn't have any symptoms. You can be totally asymptomatic. You may feel fine and have diabetes. So also a fasting blood glucose test. It's essential that you do it regularly. And what are the warning symptoms for diabetes? If you're drinking a lot of water, you'll consequently go to the bathroom a lot, even waking up to urinate. Weight loss, that weight loss you can't explain why it's happening. Weakness, fatigue, so you should investigate diabetes. These are the typical symptoms of the disease, but there are other changes you need to be aware of, like with healing. Wounds are taking longer to heal. Changes in the feet, in sensitivity, fungi, skin changes, skin infections, even fungi on the nails. So all these changes can also indicate diabetes. You're not always going to see these classic changes, so pay attention. Number 1, high blood pressure, hypertension. Also extremely common. It increases with age, and you need to be highly attentive because you may also not have any kind of symptom. And then I'm going to ask, I want you to answer me in the comments, when was the last time you checked your blood pressure? That you measured your blood pressure 3 times a week and noted down the results to take to your doctor. Have you done that? If not, I want this video to serve as a motivator for you to do so because it will greatly help you. This can prevent you from having a stroke or a heart attack, for example. So keep a close eye on your blood pressure. If you carry out this monitoring, it will be very fulfilling for me. If you write it down, which you can also do here, it would be worth me making this video. Now I'm going to give you a recommendation for something to watch. It's a video where I gave 13 tips to lower blood pressure so you can manage your hypertension better. Would you like to know what they are? It's at the top of our list. So do make sure you watch it. I'm sure you will learn a lot. Take care.